Hello, my name is Dr. Daniel Martinez. Thank you for being with us today. I am the Medical Director for the Division of Mental Health at Pilsen Wellness Center, and today's topic is going to be schizophrenia. It is a condition or a term that we have all heard of, maybe through the news or in television or movies or in books. It is oftentimes considered a scary condition. Schizophrenia is defined as a condition where a person has psychosis, and psychosis is the inability to test reality, where a person is out of touch with reality, and that leads to signs and symptoms that are very, very concerning. We usually define psychosis as delusions, and delusions, I usually like to define them as false, fixed beliefs that are not held in somebody's culture. So perhaps thinking about a person talking to Martians or talking to deceased people, or perhaps having chips inside their fillings or some instruments inside their bodies where a person feels like they may be talking to Martians, that's a delusion. A hallucination is a sensation without a stimulation. So we can have all kinds of hallucinations. We can have auditory hallucinations where people hear voices or hear other people. We can have visual hallucinations where people see things like mice or the devil or deceased people, things like that. We can have gustatory hallucinations where people have a metallic or some abnormal taste in their mouth. We can have olfactory hallucinations where people have abnormal smells. In order to be able to diagnose schizophrenia, a person has to have one of these problems for a minimum of 6 months. Then there are other things, perhaps disorganized speech, where a person, you really can't understand what a person's saying, and disorganized behavior, where a person may just be staring out into space and it is hard to bring them back. These kinds of things are what constitutes schizophrenia. The other thing to schizophrenia is that you have to first make sure that it's not a general medical condition. Oftentimes people can have significant general medical problems, say like being high on drugs, that can result in these kinds of signs and symptoms, or having a general medical problem like a tumor in their frontal lobe or a tumor in somewhere in their brain, or maybe a severe infection or problems with their vitamins or anemias or problems with their thyroid. There's a whole host of medical conditions that, if not diagnosed properly, can lead somebody to saying you have schizophrenia. I have seen a lot of people who have brain hemorrhages that you end up in the emergency room, and if you're not careful, you're going to diagnose this person with schizophrenia when in fact they might be bleeding inside their brain. The treatment for schizophrenia is dependent on the etiology, or how the condition manifests itself as a medical condition. And it is believed that schizophrenia is due to an excess amount of dopamine. In fact, using cocaine will result in an excess amount of dopamine. So that if you end up in the emergency room and you're hearing voices or seeing things, or you're not making any sense, a doctor first needs to figure out if a person is high on cocaine or has these other general medical problems, or really has diagnosis of schizophrenia. And the treatment is, you have to bring dopamine down, and you bring dopamine down by using an antipsychotic. There are a lot of medications that are considered antipsychotics. Probably the older ones are Thorazine, Haldol, Mellaril. Those come out very commonly in movies like One Flew Over the Cuckoo's Nest. Then there are other antipsychotics that are newer, in some ways better, but more expensive, and those are medicines like Abilify and Risperdal and Zyprexa and Geodon and Seroquel. And then newer ones still that have recently come up. And all these medicines will decrease the amount of dopamine. Medication should always be the treatment of last resort, but in a serious medical condition like schizophrenia, it is imperative that people get on these medicines. Of course, it's very important that the diagnosis is correct. Along with the treatment of medication, counseling is very, very important, so the person doesn't become demoralized. Can you imagine walking around and hearing voices or seeing things? That really can result in major, major problems in a person's life. schizophrenia is a very much a genetic condition, and it's seen in about 1% of the population here in the U.S. So you have to be careful when you see cases or you see people who have family history or other relatives who have a diagnosis of schizophrenia, because there might be a risk for that. Thank you very much.